See drama, Nigeria will hail thee. The MD has fainted. Yes, the acting MD of IMC, Niger Delta Development Commission, has just fainted during this hearing. The man is fainting, he's dying. Drama everywhere. But una see wahala. Hey, the man tired. Hey, MD don't pass out. Which kind of wahala be this? MD don't pass out. My brother, Nigeria is a cook's charter. MD don't pass out.
As you can see, there are nurses there and they are protesting. They said no working materials for nurses. So the thing is actually getting out of hand. This Parkland Hospital in Nubu issues, as we all know. It's actually turning to something else over here.
Good evening, everybody. I hope you can hear me. I'm Dr. Charles. Welcome to this program, Poor Health System in Nigeria and the Way Forward. I hope you can hear me. What is today's topic? Is today's topic not showing on there? Should be poor healthcare system in Nigeria and the way forward. Let me put it on the screen so we can all see. Poor healthcare system in Nigeria and the way forward. That's the topic today. The poor healthcare system. Welcome, everybody. Invite your friends as you join. Because today we're going to just do an analysis and we are going to be sending a message out to the Nigerian lawmakers, the leaders. The topic is showing, the poor healthcare system in Nigeria and the way forward. That's the topic. Should be showing because I did put it in. The poor healthcare system in Nigeria and the way forward. That's the topic and it's showing now. Right, so this is the topic today, poor healthcare system in Nigeria and the way forward, That is our topic today. And I'm not just going to go into the politics of healthcare system. I'm not going to go into the laws and the acts because that is what we are good at. That is what Nigerians are good at. We have lawmakers, senators, governors. We have all these parastatals. We have all these government organizations. We have these subcommittees, subcommittees, and they all come together. They are always making laws. They are always making recommendations. They are always making advising the government. They are always coming together and having some meeting and deliberating. They are always there together. This one is talking in front. This one is going backwards. There is always debate. No, I don't agree. I agree. So many debates going on. And this has been going on since 1800, since I was born. I've always heard of Nigerian lawmakers. I always hear of them. I always hear that there is law, they are making laws. I always hear there is always a committee on health. We have the Minister of Health. We have a subcommittee on development of health. We have a committee on immunization. We have a committee to look into the health system and how we can revamp it. We always have committees. We always have people coming together and always talking about health, but nothing has been done. The same as every other system in Nigeria. I know people say, what is the point of talking about Nigerian healthcare system? There is no system working in the country. There is no system at all working in the country. So what's the point of talking about Nigerian healthcare system? Today, I'm going to give it a twist. So I'm not going to go into the legal. I'm not going to go into the politics. I'm not a politician. I am a medical doctor who has concern over the poor masses, the citizens, the people who make up, who are the citizens of Nigeria. These are the people I am concerned about. These are the people that I'm here to talk about. These are the people I'm here to represent. And I'm going to be addressing the people who think that it's not important to look into this healthcare system and how poor and deplorable the state of our health in Nigeria is. I watched the other day, I'm going to play this video in a minute, and this is the video that really triggered my concern. And I'll tell you why I am so concerned. This video triggered my concern because, number one, we have families, we have siblings, we have sisters, brothers, we have loved ones. Every one of us, I can be affected, you can be affected. Health is not something that we say is only for some class of people. So I'm going to start by talking about what is healthcare and why would a country have healthcare? And then we'll look at the problems. I know we have lots of problems. We have lots of problems. People will say to me, oh, but Idee, you are in the UK. How do you know these things? Because my ears are on ground. Because where your heart lies, that's where you are always listening. That's where your concern is. Where your heart lies, where your mind lies, your heart probably is not in your country. Mine is in my country, is in the deplorable state of things, of affairs. I look at the citizens, I look at the poor people, and I'm concerned. People send me messages. I do live videos. I see people with health conditions, and you send them to this healthcare, and the stories you hear are heartbreaking. You don't know how to help them because I'm not a lawmaker, I'm not a president, but I can always sit here and do videos and say the way I feel, and which is the way all of you feel. So we are broadcasting this live on YouTube and live on our Health Gospel Facebook page for everybody to see, because I'm not hiding anything. I just want us to understand where we are coming from. So we are live on both our YouTube channel, we are live on our Facebook page. Healthcare is supposed to provide adequate care for the citizens. Adequate care for the citizens. Healthcare is a unit, is a system put in place by every country to provide healthcare. To provide healthcare for the citizens. What sort of healthcare? Adequate treatment, prevention, provision, promoting health, promoting good health, preventing epidemic, preventing things from happening, and then adequately treating the citizens. And healthcare is supposed to be monitoring, knowing when there is a trigger, when there is going to be an epidemic, and finding ways to prevent it from happening so that we don't lose our citizens. But in Nigeria, I've read so many laws, Nigerian Health Act, Act 2014, we are rehabilitating the act, we are jumping and running and ruling and all these things I hear about the act. We are doing things, we are in a committee, health committee on this, health committee on monitoring. My question tonight is going to be simple. Health affects you and me. President Muhammadu Buhari, Senate President, senators, all you House of Senate members, all the House of Representative members, state governors, local government chairmen, House of Assembly, Speaker of the House, members of the House, all of you doing political campaigns here and there. Listen to me and listen clearly because I am addressing you guys. I don't have any personal interest. I don't hate anybody. I don't have any personal political party or affiliation. I've got no interest for any of such. But I'm going to address you guys tonight. Health is something that affects you and affects your children, your family, your wives, your husbands, your children, not just the poor masses. Now, when you leave the healthcare system in the state that it is, do you not think that it's going to affect you? It affects you, it affects your family, it affects your children. Health is in Nigeria, there's three tiers of healthcare. We have the primary healthcare. We have the primary healthcare, which is supposed to be looked after by the local government, local authorities. And we have things like the dispensaries. Those are the places that people can run into with a headache, with a cut in the arm, with a slight fever. And they were supposed to be healthcare personnel looking after these people in the local government level. We have secondary healthcare, which are supposed to be manned by the state government. These are general hospitals and hospitals, district hospitals, which are supposed to be manned and equipped and looked after by the state government. And we have the federal institutions like the teaching hospitals, the specialist unit, the specialist hospital, like the orthopedic hospital, like the IVF hospital. Those are special units, which are supposed to be manned by the federal government. They're supposed to be equipped. They are supposed to be looked after by the federal government. We had a man called Ransom Kuti, who was the Minister of Health. He pushed the development of primary health centers all over the nation. He pushed for immunization of children. He pushed for antenatal care. He pushed for breastfeeding. He effectively made over 80% of the country have primary health care. Primary health care is where things are being nipped in the bud. Primary health care is where somebody can run in and they check your blood pressure and they say, your blood pressure is beginning to rise. Your blood pressure is beginning to rise, so we need to monitor it. That is what primary health care was meant for. We have community health workers who are supposed to go into the community doing immunization, looking after elderly people who are not able to look after themselves. That is what primary health care was meant for. But you see all these people, what really made me concerned is recent happenings. You see all these people sitting in these houses of Senate and whatever they call them, legislators, House of Senate, you see all this House of Assembly, they sit there, they will be talking from morning till night, no implementation of anything. Nothing at all is happening. And you look at the hospitals, you look at the hospital buildings, you look at the wards, everywhere is deplorable. No equipment. We do not equip our workers. We don't equip even the hospital. Everything somebody has to buy. So these citizens are left without nothing. Little things are killing people in Nigeria. And we say we have lawmakers. And I was watching this video and I saw people talking about billions. In the Niger Delta, where there is no hospital, there was a viral video going around where small children, small boys and girls, they said they are nurses. They are being trained in Delta states in a private hospital. They said they are nurses. They carry red pen and black pen. They said they are nurses. The other one said she's going for night duty. She's not up to maybe 15 years. She says she's a nurse. She's going for night duty. The other one says he didn't finish WAEC. He's a nurse. The father paid for him to train. And people are just sitting in these houses talking about billions. How did you manage the 80 billion? No, sir, it wasn't 80 billion, it was 30 billion. It wasn't 80 billion, it was 30 billion. And I'm watching these people. I'm watching them like, are you human beings? Are you people human beings? Do you have conscience? Because when we talk about human beings, we have people who have conscience. You know, you have domestic animals. You have domestic animals like cats, have dogs. They are allegiance, they have conscience. If they see you fall, they will almost run after themselves to pick you up, to help you. So these people I look at, even our domestic animals, they have conscience. They have feelings. These people I'm looking at, they have no feelings at all. And they are sitting there, and some of them are medical personnel sitting there talking about 80 billion, talking about 20 billion, not even millions, billions, when there is no one functional primary health care system, I mean a center in the local government to look after your sick mother. If your sick mother is sick, I'm going to come to the point where I will tell you the truth about your life. So there is nobody amongst you. Health is important. Let's take this health on board. Let's find a way to help. Let's change laws. Let's improve on our healthcare system. You go to local government, there is nothing there in terms of health. People are dying in their numbers of things they shouldn't die of. People are still dying of malaria. People are still dying of diarrhea and vomiting. People are still dying of worms in parasitic infection. People are still dying of those type of things. Children are still dying of fever. Children are still dying of measles. Children are still dying of cholera. Children are still dying of chicken pox. Things that are not supposed to kill children in 2020. And Nigeria is supposed to be the giant of Africa. But we still have this high mortality rate because our healthcare system is dead. Let me not even say it's bad, it's dead. It's dead. You go to the general hospital, it's like a ghost town. You go to the teaching hospital, there's even some activities there, but there is no equipment. There is no facility. These doctors, some of them are working with their hands against the tide. They are not paid well. The nurses, I showed you a video here where nurses are rioting for 5 months pay. 5 months pay. And you expect this nurse to look after you and smile? You expect these nurses, you see all these nurses, the way they are talking to people. How do you want them to talk? When they are hungry, when they have family to feed, when they have children to look after. It's not because they are nurses, then you don't pay them. Doctors are not paid well. The hospital is not being equipped. So then what do we have? We have proliferation of all sorts of clinics in town. We have multiple private hospitals everywhere, run by medical doctors, non-medical doctors, quacks, 419ers, scammers, running hospitals, private hospital, paying huge amounts of money to the Ministry of Health to keep them, license them, to operate. And most of these places, when I hear stories, my body shrinks and I'm asking myself, where are we going? There is no future. There is no headway. I'm not doing this video for you to say, okay, she wants headway. I don't see any headway. I don't see any future. It's dark. It's clammy. It's dark. The future is dark. People keep dying for things they shouldn't die of. So there's this multiple private hospitals, private clinics, like churches. They are doing competition with churches. So if the church says it's not a hospital problem, the doctor will tell you it's not a hospital problem. They hand you over to their pastor. Their pastor collect the remaining money. They say it's not hospital problem because the doctor is quack. They are so 80% of these hospitals you see in all these could be places, clinic, Christian International Clinic, Zion Clinic, they are all quack, killing people, telling you need to wash your blood when you don't need to wash your blood, telling you need this injection when you don't need it, telling you, oh, you need antibiotics, we will give it to you. They give you something in a paper when you don't need it. So they are everywhere, deceiving people like the churches, deceiving people like the ministries, like our GOs and prophets and papas. So these private hospitals are also doing their own because nobody is interested. Our life don't matter. The citizens' life don't matter. All that matter to you is the billions that you are packing into your stomach. Do you not get constipated? When you pack too much money into your bosom, do you not get constipated? I look at most of you. I'm talking to you lawmakers. You will see my video one day. I'm talking to you lawmakers. You call yourself senators, House of Assembly members. You have arrived and you are big. I see all of you with pot bellies. I see all of you obese. I see all of you. I look at you with chronic illnesses. But yet, you abandon the most important system that is supposed to look after you. Some of you are dying because, and you are dying because you forgot that your health matter. You forgot that one day you will need medical care. You forgot that when you are packing this money, they said this money is to go and rehabilitate or is to go and develop federal medical center. You eat the money. They said this money is to help with children immunization. You eat the money. There are no vaccines for children. So children are dying of measles, of chicken pox, because somebody sat somewhere and took the money and built a mansion and bought cars. And you allow like more than 100,000 children to die because you want to build a mansion. Because you want to build a mansion. They give you money to implement vaccination in your local government. Brother, you eat the money. Brother, you eat the money. How do you sleep when children are dying? Because you couldn't provide the vaccination that they needed. You took the money and you bought a big car and you built a big house. How do you live? What is life to you? What does life mean to you? Is it driving big cars, having 50 side chicks, and then driving big cars and living in big houses? Is that all life means to you? You are in a position to change, to make policies, to help the poor masses. You do not do it. You eat the money. They say Niger Delta is not developed. It's not developed. Look at how we are. We are the oil producing people, but they are giving you billions Look at the people. Look at the people in those slums. Look at those children filled with worms. Look at those children dying of kwashiorkor, marasmus. Look at them, wasted generation. And you're packing billions. And you're packing billions. And you sleep at night. Not even one functioning hospital in your state that your citizens can go in and get help. Not one. Not one that they can go in and you don't ask them to pay for card, they don't pay for oxygen, they don't pay for paracetamol, they don't pay for IV fluid. None. But you are eating billions. You're embezzling billions. I'm talking to you, minister, senator, House of Assembly, president, all of you. You think you can just fly out, go abroad and go and get medical care. You don't care others can die. You can just smoothly fly out. When you have headache, you fly out. When you have palpitation, you fly out. Your eye is doing you somehow, you fly out. You have ear infection, you fly out. You go out, leaving the citizens, over 200 million people, are faith. But you have been given billions. Billions is what you people are calling. Billions. Billions, Mr. Senator. Billions, NDDC. Billions, Ministry of Health. What are you doing? Go and check the record of Dr. Ransom. Was he a doctor? I don't know. Ransom Kuti, 1985 to 1992. Look at what he tried to do. Everything he tried to do, you guys have destroyed it. He pushed for safe breastfeeding. He pushed for childhood immunization. He pushed for primary health care centers in almost all the local governments. He built them. He made sure they were functioning. And as that man was no more, none of those things, not up to 10% of those things are functioning again. All I hear is he took 80 billion. No, it wasn't 80. It was 30. It was 20 billion. All this billion, I'm asking you, where would you keep it? Do you know that one day there's something called emergency care? That your health might need urgent attention? President of Nigeria, Muhammadu Buhari, our president. You are our president. We are supposed to trust you. But when you're flying everywhere, for ear infection, you fly. For eye, you fly. Have you looked into 200 million citizens, how they are surviving? Do you know that children are still dying of measles? Senate President, do you know that children are still dying of kwashiorkor under your noses? You are sharing 200 billion, 80 billion. I'm going to play the video now so that you won't say she's just talking. And then you faint. You faint. You faint. You faint. When you faint, you now pretend that you're fainting. I'm just going to play this video because this is where...
MD don't faint, oh. MD don't faint. MD don't faint, oh. Y'all gas MD, oh. Y'all gas MD. See drama, oh. Nigeria will hail thee. The MD has fainted. Yes, the acting MD of IMC, Niger Delta Development Commission.
So why did I play this video? Now I want to address you guys. Anybody that will hear or see this video, I want to address you guys. You see health, you see our health. You might think that you are okay, you have money. I can take care of my health. My doctor is in Germany, or my doctor is in America, or my doctor is in Cuba, or my doctor is in Dubai, or I have a doctor in India, so he's my personal physician, so I can take care of my health. Now, COVID-19 came. There was a lockdown. People were not traveling. Some of you were still sneaking to travel for health's sake. So take, for example, you're in Nigeria. You're a Senate president, or you are a member of the House. You are in Nigeria for an important meeting, like this guy. He was before the hearing and giving explanation for all the billions that was missing. And suddenly something happens, and I'll tell you, these are things that can happen to you, emergencies. Where do you think that you will get help from? For example, like I see most of you with chronic illnesses, you faint. Like this guy, probably if he fainted in reality, and you see, you watch what is going on there, no basic support, no basic first aid. Nobody in that place is trained to even keep the person in a recovery position to allow oxygen to flow in. Nobody knows. Everybody's dragging his mouth to open it. Everybody's holding his head. What if something happens to you, Mr. Senate President, in your house? What if something happens to you, Mr. House of Assembly Speaker, in your house? What if you faint, you need oxygen? Have you equipped any emergency services to help you? Where do you think, who will come and help you? Your personal physician, how is he going to help you? But by the time he drives into your house, has he got the facilities, the equipment to help you? You guys just think that when you have money, that's it. I don't see this as being normal, because you will faint. You will need emergency care. For example, you have hypertensive crisis. You go into coma, you go into shock, or you faint, or your sugar level is low, you faint. If nobody knows the ABCD of emergency care, you will die of low sugar. All those billions stacked out there, for what? For who? You would die in your Abuja mansion because you can't have a private jet flying you out by 1 a.m. You need that emergency care right there. You need to think. You need to listen. You need to think. Healthcare system is very important. They need to be functional for your sake, for your children's sake. What if your child has an acute reaction in the middle of the night? I mean, your precious child. You've not paid the nurses for 5 months. Where do you think the nurses will come and be happy to make sure that that child is alive? Where do you think that doctor will be happy? You haven't even given them enough equipment? Or because you have people who have come to Nigeria to open all these private clinics, you can afford them. You can afford them. What if something happens to you somewhere where there is nobody to rescue you, to help you? Have you thought about that? Do you ever think that you will need health care? You will need health attention? Do you even think? I see people go and say, we are doing training, basic life support training all over Nigeria. Let me tell you, before you train anybody to do basic life support, before you train anybody to do compression, there has to be an ambulance standing out there. How long will you keep pressing on somebody's chest? You need somebody to take over and know what they are doing. So it's completely useless in a country where there are no ambulance services to be pressing somebody's chest. Because we do it while waiting for ambulance to arrive to connect the person and help. Young people just collapse. When they collapse, they die. The same with you guys who are lawmakers. Some of your colleagues have collapsed and died. Some of them have died of little ailment they're not supposed to die of. Health is not just a poor man's thing. It's all of us thing. It's not a poor man illness. Health is me and you. You can get up in the morning, well, you go to your office, you collapse, and that's it. If there is no emergency care, you are dead and gone. Where will you keep all these monies? 80 billion, 50 billion. This money I hear would have built us state-of-the-art hospitals where people will have care. But there's no way. Everywhere, there is nothing working. All we hear is billions, billions, billions. Where are you taking all this money to? Where are you taking all this money to? Look, in emergency care, I know most of you have died. You have died, some of your colleagues. Look inwards. You may not tell us the truth, but that is the truth. Some of you have died in your houses. Why? Because of your greed. The money you would have put into the system to work, you are gulping it yourself. Nothing is working for nobody else. Just you, money, money, money. How do you want to eat this money? How many beds do you sleep? How many cars can you ride in one time? How many water can you drink? How many food can you eat? Think. Nigerian politicians, think. Leave and let's leave. Leave and let the citizens leave. Leave and let people leave. Think about the masses. That is the essence of life. You pack all this money. I was watching a panorama by Al Jazeera the other day. All the big houses in the London High Street are all bought by Nigerian politicians. Some of them have been there for years, empty. Nobody is living in it. But that is the money you would have saved more than 50 million Nigerians. You came and bought a property, left it. Nobody is living in it. Empty. Vanity. Greed. Think of what 50 billion can do for your community. Primary health care, children, free medical care for them, equip the hospital. Think. Think. I'm tired. We are sick. We are tired of watching you people displaying all these things. 80 billion. What did you do? It's okay. It's okay. It's okay. It's okay. Off the mic. It's okay. And people are just laughing. Children are dying. Children are dying of fever. They go to the hospital with anemia, lack of blood, no blood. The mother, no blood. The father, no money. He has run away. Mother is begging, is crying, help my child. They say, madam, if you don't pay for the blood, no blood, no cannula. The woman has 50 naira in her pocket. She's watching her child die. And you are sitting somewhere talking about 80 billion that you cannot account for. 500 billion million that you gave to people to go and identify your projects. 30 billion. They give you take all this money A pregnant woman cannot access antenatal care. She has to go and deliver in somebody's house because she doesn't have money to pay the big money that you people are charging. And then she dies. Every day, thousands of pregnant women are dying in this country called Nigeria. You guys don't care? You guys don't care? Don't you have a heart? Can one of you not rise up and say, look, we need to put these things in place? Why can't you not provide free medical care for children and elderly and pregnant women? What is so difficult for you to do? Why is that so difficult? What laws are you then putting in place? Every day you are talking, speaking English. Speaking English. You watch them in the house with anger. You watch them, you feel sad. They're speaking English. We set up a committee and the subcommittee members, Mr. Day, Mr. That, Mr. This, you're supposed to look into National Health Act of 2014. All these jargons, year in, year out. People are dying. People are dying. People are dying. Mr. Senator, sir, Your Excellency, President of the Federal Republic of Nigeria, sir, Minister of Health, sir, people are dying. Your citizens are dying. They cannot afford health care. It's not affordable to them and it's not there for them. What is there for them are private clinics run by touts, which you don't control, run by people who some of them never went to medical school, and they are killing the citizens. They are killing the citizens. You don't care. You don't care. You have a chest pain in the middle of the night, Mr. Senate President, House of Senate members. Imagine that you have a chest pain in the middle of the night, crushing chest pain. Before you arrange your private jet to take you to Dubai, you would have died, because if your artery has blocked, it doesn't last long. You would die. You would die a painful death because you refuse to put things in place that will help you. Suppose you have pain in your stomach in the middle of the night, twisted bowel, or your bowel lacks oxygen, they call it ischemic bowels. You need emergency to rush you into the hospital, to identify what is wrong with you, to go in and operate and help you to live. You will not live. You will die. You will die because you're ignorant of the fact that your health is also at stake. Your health is also at stake. You can patronize Dubai as you like. You can patronize India as you like. I've got no problem with that. You can go to Germany. You show your private physician can be from America. While the one that looks after your skin, India, the one that looks after your eye, Dubai, I don't have a problem with that. But in a country where you don't have healthcare, you are in danger. You are in danger. Yourself, your wife, and your children. So some of you have to rise up and start making laws that will favor changes in the healthcare system for the citizens, for you and for all of us. How many Nigerian citizens can afford to pay for private clinic delivery, private hospital care, private hospital, even to see a doctor, 15,000, 20,000? How many? I am pleading with you guys that sit down and talk about billions to look into the health system. Start looking into primary health care, secondary health care, tertiary health care, emergency care. We need ambulances on the streets. We need paramedics, train them. They will save your life and that of your children. They will save your mother's life. They will save your aged mother's life in the village. All these monies you pack and pack and pack. All I see you people do is build houses, buy houses, pack the money in foreign places. Do you see any Indian come here to say my personal physician is in Nigeria? Do you see anybody from the United Emirates come and say my personal physician is in Nigeria? Are you not ashamed of yourselves? Not even one government-owned hospital, one that is state-of-the-art that people can come from all over the world to come and meet specialists there. Is that not shameful of you all? Is that not a big shame? You're working hand in hand. Church is deceiving people. Private clinic deceiving people. Where do you place the citizens? Where do you place them? You want all of them to die? You alone will live in Nigeria? You alone, lawmaker? You can do more, Minister of Health. You can do more. There is so much to do. Forget everything. People are dying of things they should not die of. Forget politics. Be a human being. Have conscience. Have conscience on the poor people. Have conscience, because one day you will need it. Some of you have died. I don't want to mention names. You've died suddenly. That suddenly could have been saved if you have put healthcare in place that is supposed to be. I'm crying out this night for you, all you lawmakers. I'm crying out for you. It's your health also, not just our health. What are we supposed to do? If you think, okay, these people need, we can't give them free health, why don't you make health insurance affordable? Make it in the primary level, local government level. Let it be affordable to the poor market woman, the farmer. Subsidize it. Let them have a card that when they are ill, at least they can access health care. You have things they call NHIS, National Health Insurance Scheme. Hogwash. People are just eating the money. The aim of that organization is defeated because of greed, because of corruption. NHIS. If you read the documents in NHIS, it was to give children free health. It was to give elderly people free health. It was to give pregnant women free health. The workers were supposed to subsidize it. Where would the workers get money to pay their own and subsidize when you don't pay them salaries? So that NHIS, with all the noise you made, hogwash, all gone, greed. Make state-owned insurance scheme for people in your state. State-owned insurance scheme. Think about the children. Make children health free. Let the mothers be able to access health for them. Let elderly people from the age of 60 be able to walk into the hospital and access health care. Please, Mr. President, senators, lawmakers, you need to listen to the plea we are pleading. There is no way it doesn't affect you when the healthcare is not there, is dead. Some of you have died. You don't want to say it. You collapse and you die. Some of you, your wives have come to harm. Some of you, your children have died. How many more do you want to die? We need another ransom Kuti who will rise up and put changes in the healthcare system and look with mercy and compassion on the poor people dying and say, no, we need primary healthcare back. We need our primary healthcare back. We need our hospitals back. We need the state government hospitals back. We need to keep our doctors, equip them, pay them well so they don't leave the country. We need to train and pay our nurses. We need to equip our hospitals. This is what we need to do. This is what we need to do. So supposing this man, this is the end, I'm coming now. Supposing this man actually fainted. Supposing this man actually fainted. So that is how, now so the man go just die. Now so the man go just die like that. Person they hold him mouth, they open, they drag. Person wey faint, no get oxygen. 10 people have surrounded him. Nobody knows in the whole of your House of Senate with big billions, no face aider, no one face aider. Is it not a shame? Big shame. No one face aider. Face aider, not even one. All of you jumping with your jacket to go and drag his mouth. Did he faint because his mouth closed? Drag his mouth. Some are pushing on his eyelid. Some are giving him malt. If you faint, is that the way you want somebody to treat you? If you fainted, chairman, is that the way you would have watched the video? Watch the video, put yourself in that place. Put yourself in that place. Is that how you want your mouth to be dragged if you fainted? Why can't you people just put yourself in the shoes of other people? Put yourself, if you fainted, collapse in your office, is that the way you want your secretary to come and drag your mouth? Will you leave? What if you need oxygen like now? What if you have an asthma attack? What if you choke? Probably you are eating pepper soup, you choke. I'm just giving you examples. Senators, House of Assembly members, governors, I'm giving you an example. What if you choke? What if your airway is blocked? You actually need oxygen. Is that the way they'll be dragging your neck, dragging your ear, dragging your eye? No face aider? That one too, you have done politics with it, eating the money, chop everything. Even to your own detriment. Even to your own detriment. Haba. If you collapse in your office, is this the way you want to be treated? Before you call your private jet to fly you out, will you not die? I hear you people say, "Oh yeah, he had a stroke. I will send the person after 2 weeks. He'll go to Germany or to America to go." They do not treat your stroke after 2 weeks. No country in the world, they will only rehabilitate you. Physiotherapy, occupational therapy. Nobody can do anything again when you've had a stroke after 2 weeks. Stop deceiving yourself and thinking if I fly abroad, they'll go and fix me. No, nobody will fix you. If you have a heart attack and it's blocked and kill your heart muscles, nobody in any part of this world will fix you again. They might just give you a pacemaker, something to help you just live. Tick it, tick it, tick it. Think. The health, your country health is priority. Stop telling people, I will travel. My doctor is in Dubai. There is so much they can do for you. In times of emergency, you need the hospital, you need the doctors, you need the nurses around you in your country to help you. Are you paying them well? Are you looking after them? Now I don't even blame anybody that is living. I don't even blame anybody. Oh, it's difficult. You enroll to be a nurse to save lives. But you go into this society where nobody cares. You enroll to be a doctor, they are frustrating you left, right, center. They don't pay you. Doctors are going on strike. In some states, they're already on strike. Nurses are carrying placard. 5 months salary not paid. Why would they not steal? Why would they not open chemists and kill people and collect money? I'm just addressing you to think. Lawmakers, this is not about us. It's about you. Think that one of you need to rise up. One of you need to rise up and do something. I'm just going to be reading comment. Thank you so much, sisters, for joining, because it's quite, this topic is you know, I watched this video of this man, and I wasn't watching and laughing. I was watching and thinking, because I'm an emergency medicine doctor. I was watching and looking, what is this? What's going on here? 2 days ago, they brought in a young boy to my hospital where I was in charge. He had a respiratory arrest. He was gray, no oxygen because he's asthmatic. A young boy, asthmatic. He didn't know, because you know, young people, they don't take it so seriously. He didn't know that this is going to resolve like this. He started having his attack, but he was just holding on till morning. Didn't call any adult. In the morning, when oh my God. Oh. Okay. He was gray, completely gone. Fuse. If we left him another 5 minutes, he would have died. He would have had a cardiac arrest. So 5 minutes made the change in this boy's life. 5 minutes. Oxygen, cannula, drugs, infusions, made the change, and he lived again. If this boy was in Nigeria, you say you have private clinics, you have posh clinics. Before the boy even finds his way to get to the hospital, he would have died. Even when we resuscitated this boy, I made him stable. I still have to transfer him to a higher center to keep him. Because I'm emergency, I don't keep people. We have to move him to a higher center to keep him and monitor him via an ambulance. The ambulance arrived within 10 minutes. Within 10 minutes, you could see the change just giving this boy oxygen, high flow oxygen. You could see the gray color becoming pink. And you look at these people, they say somebody faint, you are opening mouth, no face aider. You people are just eating money, chopping billions. Where do you put it? Where do you keep it? I said I was going to read comment, Jare. Let me read comment because there's no way out. We are just talking. We are just talking. If they will hear us, there's no way out. This is Mary commenting from the YouTube channel. That boy would have died if he would have died a long time ago, Mary. This is in Wanyoma in Nigeria because of there would have been brief illness. True, he would have died. He would have died. I thought he was dead. One of the biggest concern about Nigeria is birth control. Nigerian people are just giving birth like goats, and the government is not helping. Doctor, I would like you to give a lecture about population control in Nigeria. I talked about primary health. Ojo, Alex, let me just say something. I talked about primary health. Primary health care is very important. It is in primary health care people talk about birth control, talk about contraceptive, talk about everything. It is in primary health care. We don't have it. That is where they follow up mothers who have given birth, they talk to them, they educate them. We don't have it. We don't have primary health care. Everybody is looking for what to grab. And sometimes when you look at them, all this money they are grabbing, what do they use it for? Some of them, illness is killing them. Hypertension, kidney failure is killing them. They look pale like some man I know in Ota. Even with his white jacket, he looks sick. Too much money kills you because it wasn't meant for you alone. You collect. It kills you. Kills your kidney, kills your heart. It's not you people I came for today. Let me read comment. Bridget, thank you for commenting. Terrible situation is very terrible. It's terrible. Terrible situation. Anyone that has means to leave Nigeria, please leave. I support. Leave until they come to their senses. I don't think they will come to their senses. Bridget says, love God don't exist in Africa. Love and God don't exist in Africa. No, they are not human beings. Those are lawmakers, they are not human beings. Mabel says, isn't Wanyoma true? Because that hand is the thing that should enter the mouth. Fabulo Fola says, but they knew man did not faint now. Planned play. But they knew the man did not faint. They knew the man did not faint. I'm just saying, what if it was real faint? What if there's no first aider there? Nobody that can do resuscitation. Nobody that can stand and be stable to say, I'm the resuscitation lead. Right? I'm the one leading. Do this, calm. No, everybody's jumping with malt, with water. It's not everybody knew he was planning. Look at the reaction. Think, in an emergency, that man would have died. You see somebody collapsing on the street or having a seizure, an epileptic fit. You see people running away from him instead of running to help him. A young, promising pilot just died in Nigeria because of this same thing. Poor, dead healthcare system. That promising young woman just died. Head injury. Bam, she died. If you have an emergency in Nigeria, it's equals to death sentence. You had a head injury. I know some of them died, but how many dies? If we had good care, intensive care to look after that girl, she had no reason to die. Somebody, they said, was a young pastor woman at 40. They say, oh, she suddenly died.